Non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is a condition where excess fat builds up in liver cells. It can progress to more severe forms like non-alcoholic steatohepatitis or cirrhosis. Non-alcoholic fatty liver disease is often linked to obesity, insulin resistance, high blood sugar, high levels of triglycerides, sedentary lifestyle, genetic predisposition, certain medications, hypothyroidism, and hypopituitarism. Spectrum of disease include steatosis, steatohepatitis, fibrosis, and cirrhosis. Symptoms: non-alcoholic fatty liver disease often doesn't show symptoms in early stages. When symptoms do appear, they might include fatigue, abdominal pain or discomfort, unexplained weight loss, weakness, and loss of appetite. Complications: ascites, swelling of veins in esophagus, liver cancer, confusion, drowsiness, and slurred speech, end of liver failure. Preventing non alcoholic fatty liver disease involves lifestyle changes. Maintain a healthy weight, exercise regularly, eat a balanced diet, limit sugary drinks and foods high in saturated fats, manage conditions like diabetes, high pressure, and high cholesterol, limit alcohol consumption, stay hydrated. Diagnosis: ALT blood test, CT scan, liver function test, MRI, ultrasound, needle biopsy. Ayurvedic treatment for non alcoholic fatty liver disease focusing on balancing the body's doshas and promoting liver health. Some approaches include dietary changes, emphasizing bitter, green leafy vegetables and foods that stimulate digestion. Herbs such as turmeric, kutki, and bhui amalkai, which are believed to support liver function. Lifestyle modifications, stress reduction, regular exercise, and adequate sleep. Panchakarma, detoxification and cleansing therapies to remove toxins. Panchakarma. Panchakarma therapies offer various benefits ranging from uprooting the disease to preventing its reoccurrence. Its detoxifying action can also be employed in fatty liver. Panchakarma often offers numerous benefits for liver. The first and foremost part of Panchakarma is to remove accumulated impurities and toxins in the body. Cleansing the body reduces inflammation and fat accumulation, promoting optimal liver functioning. It also helps balance the body's doshas by bringing the doshas back into equilibrium. Ayurvedic concept on fatty liver. The Ayurvedic concept of fatty liver can be seen in a particular spectrum of disease such as staulya, obesity, udvarta, upward movement of Vat, gulma, abdominal issues, amagaravisha, accumulated toxins, and udara, ascites. Here we have presented a case of a patient, 65-year-old male with liver cirrhosis for more than 1 month. The patient's symptoms at the time of admission to the hospital included mild fatigue, a good diet, poor sleep, and 2 kilograms of weight loss in the past half a year. The patient's history showed that he used to eat a lot and had lost weight since childhood. He had a history of chronic gastritis for 8 years, as well as pulmonary tuberculosis and was a hepatitis B virus carrier. The patient's medical history shows that he ate a lot from early age and had lost weight. Liver puncture tissue and immunohistochemical staining results. Final diagnosis. Due to the patient's weight loss combined with the signs and symptoms as well as auxiliary examination, the patient was finally diagnosed with non alcoholic fatty liver disease related cirrhosis. Treatment. The patient was hospitalized again after confirming the diagnosis and discharged after treatment. The patient was prescribed to avoid a high fat diet and overeating and increase outdoor exercises. Non alcoholic fatty liver disease is the main cause of liver cirrhosis. The risk factors for developing liver cirrhosis in non-alcoholic fatty liver disease patients included metabolic factors, NASH, gene polymorphisms, and older age. The clinical manifestations of cirrhosis caused by non-alcoholic fatty liver disease were similar to those found in cirrhosis caused by other factors. Hence, non-alcoholic fatty liver disease related cirrhosis was hard to diagnose. The increase in NAFLD and emaciated NAFLD in developing countries has increased the stressful lifestyles. Studies reported that the pathogenesis of emaciated NAFLD patients was closely related to the levels of hormones related to the fat metabolism mobilization, such as insulin or TSH, and visceral fat deposition was more common in obese patients. Therefore, the presence and severity of fatty liver could be assessed by measuring the abdominal circumference and BMI.
रुको, आप ये मेडिसिन क्यों ले रही हो?
मेरे कमर में दर्द हो रहा है इसलिए ले रही हूँ।
क्या आपको जब भी पेन होता है तो आप बिना डॉक्टर की सलाह के मेडिसिन लेते हो?
हाँ, कभी कभी अगर मुझे सिर दर्द या फिर कमर दर्द या फिर पीरियड्स के दौरान पेन होता है तो मैं बिना सलाह के भी कभी कभी पेन किलर ले लेती हूँ।
ऐसा करना आपके सेहत के लिए हानिकारक हो सकता है। बिना किसी डॉक्टर के सलाह या फिर मेडिसिन का ज्यादा उपयोग करने से आपके लीवर को डैमेज हो सकता है और आपको फैटी लिवर, लिवर सिरोसिस जैसी बीमारियां हो सकती है। इससे आगे आप इसका ध्यान रखें।
हाँ, आगे से मैं ध्यान रखूंगी।
Chips are so tasty. I like all the flavors. Even me. You know which flavor? I got the chili lime flavor, and I got this one. I like this. I also like this chili.
Hey, stop!
What's that one?
Do y'all know chips are not good for your health?
Not good? They are so tasty. Yes.
No, wait, let me explain. Chips are ultra-processed food items that are deep fried in palm oil. Palm oil is considered to be one of the cheapest oils in the market. Palm oil contains 50% saturated fatty acids, which leads to fatty liver disease. Omega-6 fatty acids present in palm oil contribute to increased inflammation, leading to more severe forms of fatty liver. Not just chips, even other packaged items such as chocolates, biscuits contain high amount of refined sugar, saturated fats and calories, which lead to fat buildup in the liver. This fat accumulation can cause inflammation and damage of liver cells, leading to more serious liver conditions like liver cirrhosis and even liver damage. So the next time you crave for junk food, just remember that your liver has to pay a very high amount for it.
Nothing can beat a freezing cold drink in a hot, sunny day.
Or an energy drink that keeps me pumped all day. Want a sip, Siddhi?
No thanks. You guys really love those drinks, huh? What's wrong with daily refreshments? Actually, both cold drinks and energy drinks contribute to fatty liver diseases if consumed regularly.
Fatty livers? Isn't it only heavy drinkers get?
No, that's alcoholic fatty liver. What I'm talking about is non-alcoholic fatty liver disease. It is getting more and more common, especially among young people. Sugar-filled sodas and energy drinks are the major culprits.
Wait, really? I drink it all the time.
Exactly. These drinks are full of added sugar, which can spike insulin level and increase insulin resistance over time, one of the key drivers of fatty liver disease.
But I need the boost. What else can I drink?
Try natural options like lemon water, coconut water, or even homemade smoothies. They are refreshing and healthy. A quick walk, stretching, or even just hydration helps more than you think. Change now, then regret later. One liver, guys.
We need to treat it right.
Here's how Padarth Vigyan and Ayurveda can intersect with non-alcoholic fatty liver disease. First, herbal nanoparticle formulations. Using Ayurvedic herbs like guduchi or kasani in nanoparticle formulation for targeted liver delivery. Second, Ayurvedic biomaterials. Developing biomaterials inspired by Ayurvedic principles for liver tissue engineering or drug delivery. Third, nanotechnology. Enhanced Ayurvedic medicine. Improving bioavailability and efficacy of Ayurvedic medicines using nanotechnology for non-alcoholic fatty liver disease treatment. Fourth, biosensors for monitoring liver health. Creating biosensors to monitor liver biomarkers, integrating Ayurvedic principles